Topic 3. Supporting recovery from trauma, counselling. Counselling is a specialist response that can assist people with intellectual disability to recover from trauma and must be delivered by trained and skilled professionals. The information presented are designed to assist qualified counselling practitioners to develop their knowledge and skills when working with clients with intellectual disability. This information may also assist non-counselling service providers and support people to identify appropriate counselling opportunities for people with intellectual disability who have experienced trauma. This information does not provide foundational counselling training. Please contact an accredited provider for information on obtaining recognised counselling qualifications. As with any other person, people with intellectual disability who experience traumatic events do not automatically require counselling. Many people recover from trauma with the support of family, friends, and their community. In some cases, a more appropriate response may be to assist family members and other support people to build their knowledge and understanding of trauma responses and how they can support someone to recover from trauma. This work can be done instead of or alongside individual counselling. When choosing this response, it is important that service providers develop a clear assessment of the capacity of the relationships in a person's life to support their recovery from trauma, while recognising that people with intellectual disability may have few supportive relationships and/or may experience abuse in their personal relationships. Counselling may be an appropriate response when people demonstrate signs of an intrusive trauma response that is interfering with their quality of life. For example, flashbacks, avoidant behaviours, and experiencing ongoing fear, anxiety, and/or emotional distress. Where counselling support is indicated as an appropriate response and is provided by a suitable, qualified and skilled professional in a safe and supportive space, it can assist people with intellectual disability to process and recover from experiences of abuse, to build personal skills and knowledge that support increased personal safety, including developing knowledge of sex and sexuality, personal relationships, personal choice, and protective behaviours. Also, to promote and support improved well-being through increased self-knowledge and future goal planning, while also learning and practicing new skills and strategies, for example, relationships and interpersonal communication. 2 to 3% of Australians meet the criteria of a diagnosis of intellectual disability. This increases to 13% when expanded to include borderline intellectual disability. As such, all counsellors have a professional responsibility to increase their competence when working with this broad group of clients, as they would with any group of service users. People with intellectual disability can attend counselling for many different reasons, just like anyone else. At the same time, we know that people with intellectual disability are more likely to experience a range of personal and social disadvantage, including associated experiences of trauma and grief and loss. It is important for counsellors to be aware of the common lived experiences of people with intellectual disability, to understand how these experiences can impact people's personal well-being and relationships, and to consider how they might present directly and indirectly in the counselling context. See Module 1 for more detailed discussion of the personal and social lived experience of intellectual disability. At Wild, common experiences addressed in the counselling context can include sexual violence, including recent, historical and child sexual assault, domestic violence, post-traumatic stress disorder, exploitation, grief and loss, ongoing vulnerability, social isolation, relationship issues, childhood removal, both their own and their children's, childhood abuse and rejection, behavioural issues including at-risk behaviour, institutionalisation, housing or homelessness, lack of sexual awareness, disempowerment and low self-esteem, anxiety, offending behaviours, self-harm and self-regulation issues. People with intellectual disability may attend counselling at generic services for these and other concerns, including eating disorders, mental health conditions, attachment issues, self-harm and suicidality, and drug and alcohol issues. As discussed in Module 1, people with intellectual disability are subject to many harmful myths and negative attitudes that impact on their daily lives. This can include myths about their experience of trauma and their ability to benefit from counselling support. Counsellors and therapists are not immune to these attitudes. All members of our society are exposed to the negative understanding and depiction of intellectual disability. Myth: people with intellectual disability do not experience emotions in the same way as people without intellectual disability. In other words, people with intellectual disability can't feel. Fact: people with intellectual disability have feelings and experience emotions in the same multiple ways as people without intellectual disability. However, they may have greater difficulty identifying their emotions and feelings and describing them verbally. Myth: people with intellectual disability don't suffer trauma or feel as hurt by exploitation or abuse as people without intellectual disability. Fact: people with intellectual disability feel trauma, pain and distress from abuse as much as any other person. Myth: people with intellectual disability lack the cognitive ability to engage meaningfully in counselling, therefore they don't benefit from these services. Fact: people with or without intellectual disability may experience difficulty with abstract thought. People with intellectual disability can benefit from counselling just like anyone else, if the counselling they receive is responsive to their needs. This would include support to translate abstract concepts into concrete terms. Myth: people with intellectual disability have trouble speaking and are unable to communicate well in a counselling and therapeutic environment. Fact: people with intellectual disability will demonstrate a wide range of verbal communication abilities. Even with limited verbal communication abilities, people can communicate in many different ways if they are given the opportunity and encouragement to use creative means of communication. The counselling process, or stages of counselling, used when counselling clients with intellectual disability is the same as for any client. However, it is important that counselling practitioners are aware of and responsive to the specific needs of clients with intellectual disability at different stages of the counselling process. Referral. Very few counselling clients with intellectual disability will be self-referrals. Most referrals for counselling come from someone close to the client when their behaviour starts to impact on others. It is important to ensure people with intellectual disability understand why they have been referred for counselling, what counselling is, and what will happen in their counselling sessions. Also, what they can do if they do not want to participate in counselling. This must include supporting the person to understand any potential consequences if they choose not to attend counselling. Rapport building. Rapport building refers to the things we do to engage with and build a working relationship with a client or service user. Rapport building is the foundation of a trusting and meaningful relationship and increases your chance of understanding the client's meaning of what they tell you in future counselling sessions. The rapport building period is important for conducting an initial assessment of cognitive ability and to collaboratively establish the purpose and goals of counselling. In this period, it is also important to help the client understand the nature of the counselling relationship. This includes the role of the counsellor as a supportive, caring and friendly worker, but not as a friend. This abstract distinction can be difficult for some people with intellectual disability to understand. When people have few supportive or caring relationships in their lives, they can become very attached to the counselling relationship. What helps build rapport? Taking time. Use reflective listening. Going at the client's pace. Showing care and respect. Using appropriate humour, although you might need to check for understanding. Honouring the hard stuff while acknowledging resilience and resisting being the expert. What is important to learn? The client's communication style, what will work? The client's ability to think abstractly. Their ability to recognise and articulate feelings. Information about their living situation, what they like and dislike. Who is in their life and what relationships are important to them. A brief history. What ability they have to tolerate discussing harder feelings, experiences and thoughts. Their strengths and abilities. What they value. When will you know you are there? The client keeps turning up. When you can have a laugh. When you can have a cry and talk about the harder stuff. When the person can tell you that they don't understand. Confidentiality. Confidentiality can be a difficult concept for people with intellectual disability to understand. This should be explained and revisited regularly to reinforce the person's understanding, not simply discussed as a one-off at the beginning of the counselling relationship. It is helpful to introduce the word confidentiality to counselling clients, as it is likely that people will hear this word in other settings. Many people will be familiar with the word privacy, and it can be helpful to explain confidentiality in these terms. For example, counsellors could say, "I will keep what you tell me in counselling private," or "I could get into trouble if I tell people what we talk about in counselling." It can also be helpful to talk about trust. For example, counsellors at Wild may say, "What we talk about in counselling is important, and it is important that you can trust me with this information. I won't tell other people what we talk about in counselling unless you ask me to. It is very important to explain the limits of confidentiality, and these should be revisited often." Clients with intellectual disability need to understand that they can trust their counsellor to keep their information private. But they also need to understand when the counsellor might need to talk to other people. If the counsellor has to break confidentiality and tell someone else, they should always tell the client first, unless there is a risk in doing so. At Wild, counsellors may tell their clients they will talk to other Wild staff about their counselling work to make sure the counsellor is doing a good job. Wild counsellors ask their clients what it is okay or not okay for them to share with the client's support workers, caregivers, or significant others. These relationships can play an important part in supporting people with intellectual disability to practice strategies discussed in counselling, and can provide the counsellor with useful feedback on any possible changes in the client's behaviour and/or well-being. Other limits to confidentiality may include when a client threatens to self-harm or to cause harm to others. Closure. Closure needs to be discussed from the beginning of the counselling relationship so that clients don't think counselling will go on forever. Closure can be discussed as part of goal setting for counselling. For example, what do you hope will be different for you when you finish counselling? Closure needs to be planned and worked towards. For example, at Wild, counsellors often move from fortnightly to monthly sessions during the closure period. It is important to be mindful of how isolated many people with intellectual disability are. Many people have few meaningful relationships in their lives, which can make the counselling relationship highly valued by the client. Reflection and review are an important part of the closure process. The aim of collaborative reflection and review on closure is to highlight the shared journey undertaken while counselling. By going back to the original hopes and goals of the client, you can together look at any changes the client may now be making in their lives. Any changes in the client's choices, knowledge and behaviours over the counselling time can be discussed and celebrated. At Wild, counsellors may ask, "What is different in your life now from when you set these goals?" Responses will probably be concrete, and some are. "I talk to my sister now. I can say no if I want to. It's okay if I don't always get things right. My dad can help me. I'm not always going to be stuck back there. He can't hurt me now." Celebration is an important part of the closure process. It is important to honour the work that has been done in counselling and the changes that have been made in the client's life. At Wild, counsellors encourage the client to say how they would like to celebrate the ending of the counselling relationship. For example, with a cake or a certificate. Some clients may want to invite significant others to the celebration. By inviting family members, support workers, or significant others to the celebration, the client gets to show what they have learnt with the counsellor's assistance. This may be difficult for them to articulate on their own. It also gives the people who have been invited a chance to add their observations and gives them an opportunity to say how they are feeling about any changes in the client.
Thank you for completing Topic 3, Supporting Recovery from Trauma, the Role of Counselling. Topic 4 will look at Supporting Recovery from Trauma, Counselling Practice. But first, please return to the homepage to complete the learning activity.